Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. According to the CDC, heart disease is the leading cause of death in the United States, killing more than 500,000 people every year. And while some of the risk factors for heart disease are things we can't control, like genetics, there are many that we can control. And Dr. Troy Wiedenbeck, a cardiologist with renown, is here to talk heart health with us. Troy, thank you so much for coming on the show.
Thanks for having me.
Okay, just to start us off, how would you describe the general level of heart health in our area?
Well, unfortunately, it's not as good as it could be. There are, unfortunately, lots and lots of people who have heart disease and are diagnosed every day. I see people having heart attacks nearly every day, most of them from our local community. So there's definitely room to get a little improvement out of people.
And there are things we can do, right? I mean, a lot of this stuff is preventable. I mean, is there a percentage? How much of it is preventable?
Well, it's easier to talk about what's part of it that isn't preventable, the non-modifiable risk factors. Things like genetics, age, and your gender, being a male puts you at higher risk. Most of the other things we have some direct control over every day. Things like smoking, obesity, diabetes, our level of activity.
Okay, so if someone's heart is heading into the unhealthy zone, will they know? I mean, are there ways that they can tell, or is it kind of something that jumps out and surprises you?
Yeah, well, of course, if you have symptoms, then you need to be evaluated, and we can talk about the symptoms a little bit later if you'd like. But also, even if you don't have symptoms, there are a lot of risk factors that people have. Sometimes you aren't aware of them. High blood pressure being one of the most common ones that people aren't aware of because they've just never been checked. Diabetes is another big one. And inactivity, sitting too much is really a big deal.
So just sitting too much can cause these problems?
Yeah, absolutely. Sitting's basically like the new smoking.
Oh my goodness.
It increases your risk of having a heart attack about the same amount as if you were a smoker.
I think there are probably a lot of people watching this going, oh no, I sit for 9 hours a day of my job. How do you fix that?
There's a lot of ways you can do that. You can set a reminder to stand up and at least take a walk, or just stand and answer emails, talk on the phone a little bit. There are standing desks that you can integrate into your workflow, especially if you're in a business and you are seated at a desk doing paperwork or surfing the internet or whatever you're doing. And then there's kind of treadmill desks that you can buy and use.
What's a good rule of thumb for how much sitting is okay versus how much you should be moving around?
Well, on average, people sit about 7.5 to 8 hours per day in the United States, some up to 15 hours a day depending on the sedentary nature of their jobs. And there's a recent study that just came out that showed that if you can cut your sitting time in half from 7 to around 3 hours a day, that you can extend your life by about 2 to 3 years.
Wow. Well, that's excellent to know.
And it's easy.
Yeah, that is an easy change. Okay, so if someone is, has maybe done some of these things wrong, smoking, not eating well, sitting too much, are there physical signs that they'll be able to feel in themselves to think, well, maybe I should head to the doctor, or would you just advise everyone should go as a precaution?
I think if you have any of the major risk factors, if you're a smoker or have been a smoker, have a strong family history of heart disease, have diabetes, have known high blood pressure, and you're no longer young spring chicken anymore, maybe it's time to go and see one of your healthcare providers. There are also some risk calculators online. Theheart.org has a great website that has a risk calculator, and you can go on there. It's free. You input your numbers from your doctor, your cholesterol, your age, and some other things, and it really helps give you an idea how risky you are.
Okay, now when we say heart disease, specifically what are we referring to?
So heart disease can be several things. The one most commonly referred to for heart disease is coronary artery disease. That's blockages in the blood vessels that supply blood to the heart muscle itself and help it keep functioning.
And how does that happen?
That happens from all the risk factors, unfortunately. So your coronary arteries are normally these big open tubes, and they supply blood to your heart muscle just like pipes in a house. But they can, just like pipes in a house, have corrosion in the pipes that narrow the tube down. That's called cholesterol buildup. That's called atherosclerosis. And that's a buildup of lipids and cholesterol plaque with inflammatory cells in there. And it takes this nice big open tube and sort of narrows it down to the point where it can restrict blood flow and cause pain, symptoms called angina, or even heart attack, which was the damage if there's not enough blood flow.
And that, obviously can happen to anyone for a lot of different reasons, as you mentioned. If it happens, how do you treat it? Can you treat it without medicine or without surgical intervention?
So if you have coronary artery disease, there are lots of good medications that you can use. Diet and lifestyle can be life-changing if you just increase your activity under the supervision of your physicians, usually. But if there isn't room for medications, or the symptoms are too severe, or if you're having damage to your heart at the time, called a heart attack, then you can perform a procedure that I perform routinely. It's called a coronary catheterization or coronary angiogram, and you go in and you mechanically move that blockage that's narrowed that tube and just puff it back up and make it bigger, allowing the blood flow to get back down to the heart muscle.
But it's a temporary fix, right?
Yeah, that's a mechanical fix to sort of a metabolic problem. Coronary artery disease is a whole body process, and it's not just in your heart arteries. It can be atherosclerosis in your neck, in your legs, in your arms. And we're treating the manifestations of that with the stents and the balloons and the bypass surgery. But it's really the medications and the lifestyle changes that you make that end up treating the disease process.
Okay, so say this happens and you are having a heart attack. I know sometimes the signs can be a little hard to identify, especially depending on who the person is. Can you kind of talk about what to look for?
Sure. You know, the typical classic thing you've heard about, everybody's probably heard, I have chest pain, substernal, usually on the left side. It's kind of a squeezing, burning, kind of aching feeling. It can radiate down your arm or up to your jaw, and it can be associated with shortness of breath, feeling of nausea, lightheadedness sometimes, and a kind of a sweats, kind of a flop sweat. There are some other more subtle presentations of it, and women tend to experience a little bit more atypical presentations. Nausea predominant with some shortness of breath, some kind of burning sensation. Sometimes it radiates to your back or up into your behind on your shoulders.
That's tough because that could be attributed to a lot of things.
Sure can, but it's the severity, I think, and the fact that it's coming on with exercise in general for stable angina that you need to look out for. If it comes on at rest and continues, then you should seek medical care.
Okay. Now these days, if someone identifies, okay, I think I'm exhibiting some of these symptoms, I get to the hospital. I mean, you guys are pretty good at helping people live, right?
We like to think so, yeah. That's kind of the goal.
There is treatment for heart
Yes,
attack.
there are lots of treatments. There are medications and procedures that can be implemented that are not only life-saving, but they can improve your quality of life going forward. Those things are not only medications, but procedures like stenting and angiograms.
So don't hesitate. I mean, if you feel this kind of thing, get to the hospital right away.
Yes, but you'd be surprised how many people think, oh, I don't want to seem foolish. I don't want to, waste the people's time. We'd much rather see you and say, nope, you're having a little acid reflux, have a nice night, than see you later when you've had a really serious complication from it, and it's too late to save a lot of your heart muscle.
Absolutely. Okay, so for those of us who aren't experiencing symptoms of heart disease, are there other ways that we can stay heart healthy? I mean, for just general lifestyle things that we should do? What's the best thing you can do for your heart?
Best thing you can do for your heart is not smoke. The second best thing you can do for your heart is stand up and exercise, and then after that, maybe exercise a little bit more. Because exercise has been shown to not only improve quality of life, it improves your long-term outcomes with regard to secondary prevention, so if you've already had a heart attack, but also if you've never had a heart attack. If you exercise, and that doesn't mean run a marathon, it means 5 to 10 minutes is all it takes, 5 to 6 times a week, to reduce your risk of heart attack. A recent study from last year just showed that runners versus non-runners, you get a benefit of approximately 45% reduction in your risk of having your first heart attack just by being a runner.
Wow. Okay, when we say exercise, I think probably a lot of people think, well, running is not in the cards for me. What counts? How much, activity is enough?
So that is a great study to reference because they looked at runners versus non-runners aged, I think it was 18 to 100 years of age, and they followed them for 15 years. And those who were runners did better, 45% reduction, but those benefits persisted even in the subgroups that they looked at of people who ran slower, so less than 6 miles an hour, people who ran less frequently, so only 2 to 3 times a week, and people who ran for less than 51 minutes total in a week. So that, if you do the math on it, comes out to about 5 to 10 minutes a day of moderate activity. And that doesn't have to be jogging. It can be walking to the point where you get out of breath, get your heart rate up.
Okay, now speaking of heart rates, what's the target heart rate we should shoot for when we exercise? I mean, is there a range that's best, or does it matter?
So, there's the talk about the ranges of heart rate. Here's your fat burning zone, here's your cardio zone, here's your maximum. So in general, I don't advise people to work out at their maximum predicted heart rate, which is 220 minus your age. That's the 100% maximum kind of predicted heart rate. I usually tell people that rather than looking at the heart rate, you should kind of try to be in tune with the way you feel. So if you're exercising and you're breathing heavy and your heart's pounding and you are getting tired, then that's a good level of exertion. I don't think people should exercise to the point where they can't hold short sentence conversations. So you should be able to talk about like that. That's about as much as you should push, I think.
Yeah, I read somewhere that you should be able to sing your favorite song, and I thought, never in my life have I been running and been able to sing my favorite song at the same time. That's a good rule of thumb. Okay, so one last thing I want to hit on, we just have a few minutes left. Heart palpitations, super common. Are they ever dangerous?
Sometimes they can be. They're very common, though. They're seen in people ages, children all the way up to end of life kind of people. Most of the time, they're nothing to worry about. The sort of things that you would worry about is that if you have the heart racing, palpitation feeling, and it's associated with chest pain or lightheadedness or nausea, or especially if you've been passing out.
Okay, so the palpitation by itself, maybe not as big of a deal, but if it's accompanied with other things.
Yep, in general.
Okay, well, is there anything else that we need to know? I mean, are there any misconceptions that you want to debunk right now, or anything you want to say about heart health?
Yep, everybody thinks that women aren't at very high risk for heart disease, and that's not true. Women, unfortunately, are only seen as at less risk because they tend to be underdiagnosed, because they present a little bit less typically.
Right.
So don't ignore your symptoms just because you think I'm a woman, I'm not going to have a heart attack.
Yeah, okay, Troy, thank you so much for your time. I sure appreciate
Thanks.
it. All righty, coming up on Face the State, last year, the Reno-Sparks area saw a drop in homes for sale and an increase in the median home price. So what does this mean for people looking for homes now? We will speak with an expert right after the break.